Hi, I'm Dr. Sally Burbank, and I am an internist here in Nashville, and I'm a member of the Woodmont Baptist Advisory Committee on COVID. And I wanted to share a few words with you today about what I think you should know about coronavirus that you may not have learned from the TV or reading online. The first thing is it is an evolving virus, and what may have been taught back in 2020 is not relevant to what's going on today. For example, the original vaccines that we have were designed for the strain of the virus that was prevalent in 2020 and 21. And so those who got fully vaccinated had a markedly lower risk of getting infections or ending up in the hospital. This virus, however, mutates. And what many people don't know is that the common cold is also a type of coronavirus. Along around November of 2021, the bad-acting COVID-19 did a intermixing with the common cold type variant, and it created one called Omicron. This is the one that was prevalent during Thanksgiving, Christmas, and New Year's, and it affected a whopping 120 million people in the United States. That's 1 out of 3 Americans developed Omicron infections around the holidays. Thankfully, because this strain was intermixed with the common cold, it was in general less deadly than the Delta or the original vaccines. In addition, because many people had gotten vaccinated by that point and even had a booster, many people did have some immunity and therefore didn't get as sick as they might have. With time, this virus has continued to mutate, and so now the strains that are gradually growing in frequency is one called a BA.4 and a BA.5. They now make up 21% in the United States. And so far, the research out of South Africa shows it is largely resistant to the vaccines. Now, the vaccines may help reduce your chances of dying or ending up in the hospital, but you may still get the infection even though you may have had all 4 vaccines, your 2 original plus your 2 boosters. And so it is important to know this because even if you've been fully vaccinated and boosted, you cannot say to yourself, well, I don't have COVID, it's just my allergies making me all snivelly and congested. This variant tends to act more like a cold in many ways. You'll have major sinus congestion, drippy nose, sore throat. It acts like a cold. Now, it can get more severe. It can get down into the lungs. It can give you a fever and a bad headache. And for those who are old, immune suppressed, on medications that suppress their immune system, emphysema, morbidly obese, diabetes, and their risks are therefore not as good for fighting infection, it can end up landing them in the hospital. Right now, there are 338 people in the hospital with this variant in Tennessee. The governor and the mayor have raised the rate of risk in Davidson County to high risk. Now, again, that doesn't mean we're all going to end up in the hospital, but it does mean we're high risk for infection. And in fact, 1 out of every 5 tests that people do, their home tests, are positive for COVID. So be aware. First point I want you to learn is if you get a snivelly, drippy type thing, but you don't feel that bad, do a home test. It may be your allergies, it may be a sinus infection, but it could be COVID. And while you may do fine, your next door neighbor, someone in the church who may be immune suppressed may not do fine. So as Christians, we're called to look out for one another, do the testing. The second thing is, if you are going to be sitting next to a stranger, somebody you don't know, like on a plane, you really should wear a mask. And the most effective ones that really make a difference are the K95 ones. These are easily purchased from Amazon or online. They're definitely way more effective than cloth ones, and they're more effective than the little blue ones that everybody finds. These are better than nothing, but these are about 95% effective if you keep it on and have your nose and mouth covered. So it is important if you're on a plane, I would go ahead and protect yourself right now. How does this relate to Woodmont Baptist? First, If you have immune suppression and you have the risk factors I talked about, you may want to sit up in the balcony and wear one of these N95 masks, because there could be people around you who don't even know they have it. They may not be very sick at all and don't know they shouldn't have come to church. So protect yourself. The balcony is a totally must wear a mask, space yourself apart. We're doing that so people can come to church and still be safe. Second, stay home if you're sick, even if you don't think it's COVID, and do a home test. When you do a home test, make sure you really swab pretty deeply in and make sure you swirl it around for a minimum of 5 seconds. The test that I have actually says 15 seconds per nostril. So you won't get an accurate test if you just kind of swab a little inside the nostril. Also, testing timing is very important. On average, it takes 5 days from the time that you get infected with it before you will show symptoms and test positive. So for example, if I had COVID right now and I went and coughed all over Andy, he will not on average test positive until 5 days from now. And this is important because if a friend or someone calls you up that you were with yesterday and says they're positive, if you go out and test today or tomorrow, you may get a false sense of security that, oh, I tested negative. No, you have to wait 5 days to test, or sooner, obviously, if you get sick, because it can start turning positive at 3 days. It may be 7 to 8 days, but the statistical average is 5 days from the day of exposure. Other important things, monoclonal antibodies do not work for the strains we have now. They worked great for the Delta that we had back in September of 21. They don't work, they don't even make them anymore. What you can get is a pill antibiotic that is specific for coronavirus called Paxlovid. It is a 5-day course of pills, 3 pills twice a day. Your doctor can prescribe it, and it will cut the viral replication. Doesn't kill the virus, but it does keep it from reproducing and giving you a larger and larger viral load. And obviously, the greater the viral load, the more sick you're going to likely get. So you have to start it within 5 days of onset of symptoms, because if you wait 6, 7, 8 days because you thought it was your sinuses before you test, may not help you much because you've already been making all that virus. But be aware, if you get the infection, you test positive, call your doctor and you can get on a course of Paxlovid. It does have drug interactions with cholesterol drugs and a few other medications that you may need to stop when you're on it. So be sure and discuss it with the pharmacist if there are any drug interactions. You also shouldn't take it if you have bad kidneys or a bad liver because it is metabolized in a way that might be harmful. But you can discuss that with your doctor. The church has an air purifier system, and so we are doing everything we can to try to purify the air and keep the place clean and safe. In terms of boosters, even though, again, it's not going to guarantee you won't get sick, we have found they do reduce your chances of ending up in the hospital or dead. And so we recommend a booster 4 months to 5 months after your last booster, or 4 to 5 months after you had COVID. So if you had COVID back in January or Christmas time, then it's not too early for you to get another vaccine. There is a new one coming out, and this will be very helpful. Moderna is making one that is specific to the Omicron variant, not the variant that was back prevalent in 2020. And so that is projected to come out in the fall, and we hope that will be out in time to prevent the expected increase when kids go back to school. That's the information I wanted to provide for you today. I hope you'll find that helpful on knowing when to test and what you should do if you test positive, and also how you can protect yourself. Thank you for listening.